Perfect intubation of the esophagus during upper gastrointestinal endoscopy allows us to maximise patient comfort, minimise gagging, and of course avoid any potential complications such as perforation of the pharynx. In order to achieve this, one must ensure that one's every movement are slow and precise. After the usual pre-endoscopy scope checks, it is important to ensure the patient is in the correct position. This of course is the left lateral position without any arms or legs protruding off the bed that can get in our way and make intubation tricky. Arms should be placed in front of the patient or on their side. One must also check the mouthpiece is properly positioned to ensure that the tongue does not get in the way and block the entrance of the scope. The scope should be inserted with the tongue at the 12 o'clock position, which ensures that your scope is in a neutral position upon intubation. You should slowly advance the endoscope over the centre of the soft palate until you reach the uvula. At this point, slowly move the big wheel downwards, which alters the tip of the scope and allows you to gently curve the scope over the base of the tongue. This ensures you don't irritate the uvula, which can cause unnecessary gagging. Once the scope has entered the hypopharynx, you want to then straighten your scope by moving the big wheel back upwards slowly. Here in front of you, you'll see the epiglottis, the vocal cords and both piriform sinuses. Importantly, if saliva or other secretions blocks your view, do not use the wash function to clear your views. This will spray water into the airways, which can be dangerous, but also cause a cough reflex, which makes intubation tricky. To clear your views, you want to use the suction function. You want to advance your endoscope slowly towards the hypopharynx, allowing it to naturally pick one side or the other in terms of the piriform sinuses. Once you get to the hypopharynx, you want to gently torque your scope back towards the midline, depending on which side you're on, and advance the scope with gentle but consistent pressure until you intubate the esophagus. Intubation is the most stimulating part of an endoscopy, so often at this point I'll pause for a few seconds to allow the patient to recover.